Good evening, everybody out there in social media land. This is Dr. Adam coming to you to talk to you about the wonderful world of headaches. Now, tonight's Spinal Workshop, we're going to be talking about something that is a literal pain in the neck, right? Even though I said headaches. So, first things first, I want those of you out there to understand if a doctor, myself, or others refer to your migraines as a headache, we are not downplaying your migraines. Migraines are a form of headache. So are cluster, so are tension. There's a ton of different types of headaches, okay? Yes, it is much more specific and much more personalized to your issue if we call it a migraine, or we call it a migraine substantiosa with aura, or whatever the case may be, right? We can get into all that lingo. But doctors like myself try to use generic terms. Why do we do that? Well, we do that because we're taught in school to explain everything to somebody that has an 8th grade education level. It's not to say that you, who has a master's, is ignorant and doesn't have the knowledge, okay? It's kind of a generalization. We teach it as though somebody only has an 8th grade learning. Why is that? So that we can teach to the majority, not the minority. Just like a headache versus a migraine. Headache is a majority term or a generalized term. Migraine is a specific term, especially if you're talking about with or without aura and a whole bunch of other stuff, okay? So please don't be offended. We're trying to do our best, and it is for everyone's benefit. Yes, I understand that you came into me with migraine style headaches. And you'd be surprised how many people will say, I have migraines and it's actually a tension headache. Or I have migraines and it's cluster headaches, which cluster headaches can be worse than migraines. So Google doesn't always get it right. AI rarely gets it right. Okay, so putting your symptoms into a machine does not supersede my doctoral degree. Okay, so please understand that too. I try not to take offense when I'm corrected and somebody says, well, no, I have migraines. Okay, I understand this. You have migraines. You have pain where? Well, it's all the way across here and it's in the back of the head. That's not a migraine. Okay, migraines are typically one spot, hemispherical. You typically have an aura. Prior to those, you have photophobia or audiophobia, so fear or sensitivity to light, sensitivity to sound. And if you don't have any of that, you typically don't have a migraine. Okay, now you could in other things. And then there's migraines that have absolutely no pain associated. Yeah, optical migraines don't have any pain associated with it. Okay, sometimes they can, but a lot of times they don't. So I like to use the generalization of headache because your head hurts. Okay. So if you want me to get into specificity of your particular condition, I will. I'll do that for you. But don't be surprised if I don't classify it what you believe it is because of what you looked up on Google. Okay. And we can talk about why. And we can look it up together and we can find out why Google said A and I say B, or whatever the case may be. I'm happy to help educate those that would like that education. Okay. So let's talk about the fact that 70% of headaches, generalized, are caused by issues in the cervical spine. So you have these wonderful muscles that keep your head on your neck, right? They're called suboccipital muscles as a grouping. Yes, I can get in and tell you that it's splenius capitis and splenius cervicis and all the other ones that are there. I can go through and name them all if you would like me to, but I don't think that that is the reason why we're here. I think the reason why we're here is to learn a little bit that those muscles can get really ticked off, right? Why do you think they get really ticked off? Well, a lot of it has to do with forward head posture. Okay. A Look how far forward your head is on your shoulders. If it's anything past an inch, it's causing a lot of damage to those muscles, which they're in turn starting to spasm and are causing issues with muscles like temporalis and a few others that are then causing headaches. Okay? So by adjusting somebody's cervical spine, we can reduce that forward head posture, right? We can help to reduce the subluxation or the misalignment that is in the cervical spine that is putting pressure on those nerves. And we can allow that person to function better, therefore, and ergo, reducing headaches. 70% of the time, headaches can be reduced with a simple adjustment. Now, am I saying to go ahead and have your boyfriend, your girlfriend, your husband, your wife, your spouse, your friend, your uncle's third cousin twice removed, I don't know, mess with your cervical spine? Absolutely not. Okay? Have a chiropractor do this. There is a risk of stroke. Yes, there is. Cervical spine and atlas, C1, C2. So atlas and axis, there is a risk of stroke of a chiropractic adjustment in approximately 1 in 4.2, 4.25 million upper cervical adjustments. There is a chance of stroke. 1 in 4.25 million. So I don't think that's too risky. Now, let's talk about going to the hair salon. You go to the hair salon and have your hair washed. Your risk of having a stroke from that is 1 in 275,000. It's a hell of a lot higher risk, okay? If you have somebody that's untrained and starts messing with your neck, I'm sure that risk goes way up, okay? Why do chiropractors see signs of stroke in their office? Well, because it's the worst headache of your entire life, okay? It is associated with neck pain, stiffness, all these certain things, which are typical reasons people come see us. Does that mean that because we send you to the hospital that we caused it? No. It means we found it and sent you to some place that can help alleviate it or abate it or whatever. So we do tend to send people to hospitals when those things happen. But the chances or the risk of a chiropractor causing an upper cervical, like vertebral dissection, right? The vertebral artery that goes through there, to have that to tear is 1 in 4.25 million upper cervical adjustments. So keep that in mind. So very, very safe, if you ask me. Start looking at, if you ever think that any doctor is questionable safe-wise, start looking at malpractice insurance rates. They're out there on the web, okay, or on the interwebs, as some of my friends on the internet tend to call it. But look out there. Chiropractors pay in a year what a lot of doctors pay in a month. If we are unsafe, we'd be paying a hell of a lot more in our malpractice insurance, don't you think? Because it'd be a bigger risk. But because our risk is quite small, so are our premiums. So keep that in mind. I know this kind of came off a little bit as a rant today, and I apologize for that. It is more for clarification for all of you. Yes, headaches suck. Yes, migraines are a form of headache. Yes, 70% of the time, headaches can be alleviated with a proper chiropractic adjustment. All of those facts are true. If you're wondering how chiropractic can help you deal with your headaches or other things, give us a call or leave us a comment below, and we'll gladly return that comment. For the rest of you, I look forward to seeing you later today and later today, later this week, and early next week for your adjustments. Thank you very much, and I wish you all a beautiful evening.